Good afternoon, everyone. I would like to thank the organizers for extending the invitation to speak at this event, and I'm delighted to have the opportunity to present an overview of comparative effectiveness research on sleep disorders funded by PCORI, and to hear from other participants during this forum. Next slide, please. So for those who may not be very familiar with PCORI, our mission is to fund clinical comparative effectiveness research that produces high integrity evidence to help inform decision-making and improve healthcare delivery and outcomes. So our research is guided by patients, caregivers, and the broader healthcare community through meaningful engagement. And our strategic goals are to inform healthcare decisions by increasing the quantity, quality, and timeliness of useful, trustworthy evidence. We also aim to facilitate the rapid implementation and use of this evidence. And finally, we seek to influence others' research to be more patient-centered. Next slide, please. So how is our work different? Well, we fund research that answers which care options works best for whom and under which circumstances. Our studies focus on questions that matter to patients and their caregivers, and we want research findings to be adopted and therefore seek to produce evidence that can be applied to real-world settings. So our studies engage patients, caregivers, and a broad range of the relevant stakeholders to ensure that we get the research question right and that study results will impact clinical practice. Next slide, please. So as of September of this year, PCORI has funded 7 studies focusing on sleep disorders research for a total of $17.5 million. We also funded an additional 5 studies representing over $25 million in funding that focus on other disease conditions such as mental or behavioral health or chronic conditions and their impact on sleep. So all of these projects are investigator-initiated studies through our broad PCORI funding announcements, which I'll discuss later in this presentation. Next slide, please. So our funded research on sleep disorders falls into 2 categories, those that focus on insomnia and those that focus on sleep apnea. And so remember, these are investigator-initiated. The interventions that are proposed for comparison for insomnia are shown on the left, and the comparators for the sleep apnea studies are shown on the right. So there are 3 funded insomnia studies and 4 funded sleep apnea studies. So for insomnia, some of the interventions include acupuncture, CBTI, drug or a combination therapy of drug and CBTI. Some of the sleep apnea interventions are shown on the right. I won't read through all of them, but they include peer support, education, sleep apnea screening tools, etc. Next slide, please. So given the time limitations of the presentation, I wanted to highlight one relatively new funded study that we're looking forward to see results from, and this is a large randomized controlled trial. And so this trial focuses on adults diagnosed with insomnia who will be enrolled at primary care clinics across 8 health systems in the US. The interventions proposed for comparison for this trial are internet-based cognitive behavioral therapy for insomnia, Zolpidem, and combination treatment involving the drug and CBTI. So this is a 3-arm randomized controlled trial of 1,200 patients. The primary outcome is insomnia symptoms. The secondary outcomes, there are multiple outcomes, but some of them include sleep quality, cognitive function, mental and physical health, and adverse effects. So this trial has the potential to have impact on patient and provider decision-making. It will also provide long-term outcomes at 12 months. And the design of this study was informed by the strategically Leverage, Engage, and Empower PCOR and Sleep Engagement Award. And this award helped to fund and engagement activities that resulted in the in patients and stakeholders, informing the selection of patient-centered outcomes, research questions, and comparators. So findings from this study could help guide treatment choice for insomnia patients, and positive findings for internet-based CBTI may provide a more accessible and sustainable treatment options for patients. And I wanted to get back to Dr. Kiley's comment about disparities. We do have an ongoing trial that looks at insomnia, not sleep apnea, although PCORI is very interested in addressing disparities in healthcare in general, because that's one of our national research priorities. But this ongoing trial in insomnia looks at an internet-based CBTI program compared to one that is tailored to African American women. So it addresses a disparity in that particular population. Next slide, please. So as far as our funding opportunities, I mentioned the broad PFA, which encompasses our national research priorities, which includes the assessment of prevention, diagnosis, and treatment options area, improving healthcare systems, addressing disparities, and communication and dissemination research. And then some dates on the next PFA letter of intent deadline are shown there. So very briefly, I'm going to talk more about the assessment of prevention, diagnosis, and treatment options, or APDTO program, on the next slide, but I'm just going to very briefly describe the Improving Healthcare Systems program, which focuses on improving access to high quality, equitable, and efficient care through healthcare system level interventions. Our Addressing Disparities program focuses on reducing or eliminating disparities in patient-centered outcomes, including healthcare and patient-reported outcomes. And our Communication and Dissemination Research area focuses on communicating or disseminating research results to patients, caregivers, or clinicians. So now I'm going to talk about our APDTO program, which is the program through which most of our sleep research studies are funded. So this particular research area of interest, or our national priority, is interested in studies that propose direct comparisons of 2 or more clinical services for identifying, managing, or treating specific diseases. The proposed studies should be justified by a well-defined evidence gap, and it should really address a compelling decisional dilemma that's facing patients, clinicians, or other stakeholders. The studies should also take into consideration treatment effect modifiers, including demographic, biological, clinical, socioeconomic, and other factors. And on this slide is just an example of our last cycle and the types of studies that are funded. So you're able to apply for larger or smaller studies, which have different direct costs and project duration. Next slide, please. So this slide shows you some additional resources. If you are interested in learning more about PCORI, I would really encourage that you explore our website. There are links to our funding opportunities page. You can also explore our portfolio to see the types of studies we've already funded. And there are also frequently asked questions page where there are a number of resources for anyone who's interested in applying. And so with that, I know we're over time, so I want to be respectful of the schedule and the talk, but I'm happy to take questions if there are any.
Thank you, Dr. Do. I love PCORI's work, and Project Sleep has been a partner on a few of the projects. And I know we actually probably have some other patient advocates. I know Art is here, a patient advocate on the Insomnia, one of the Insomnia projects from PCORI. So thank you for your investment in sleep disorders and sleep.